Okay, now that we have a plan for your diabetes, I wonder if we can spend a few minutes talking about how you take your medicine. I know you have a lot you have to take. And we know everybody misses their medication once in a while. I wonder how often a typical week you miss taking a dose of your medicine.
Probably 2 or 3 times a week. I just have so many pills I have to take. To be honest, it's kind of a lot.
Yeah, I understand it could be a lot to manage. Now, help me understand. Is it you forget taking all of your medicine or just one in particular?
Mostly it's that one medication for my diabetes, metformin.
Okay. And tell me your thoughts on how that medicine is important for your health.
Well, I know my diabetes needs to be under better control. I think a lot about my aunt who had diabetes, and she had a terrible time with it. She had nerve pain, it affected her vision. And I certainly don't want to end up like she did.
Yeah, it's really scary, isn't it? And we do know that if diabetes is not well managed, it can affect lots of different parts of your many different organs. So this is an important conversation for us to have.
Mhm.
Now, I know that some people stop taking their medicine because of side effect. I wonder, have you had any bad reactions or experiences with the medicine?
It upset my stomach when I first started, but that's really gone away now.
Oh, good. I'm glad. Okay. So, what makes it hard for you to take the metformin?
I have to take it twice a day because insurance won't cover the cost of the once a day pill. It's just so much to keep track of.
Yeah.
And my husband's on a lot of meds too, so we have a lot of pill bottles in our house.
I bet you do. Now, where do you keep them all?
Oh, we keep them all on a basket, all of our pills in a basket on the kitchen counter. That way we know where they all are.
Okay. Well, I'm glad you keep them all together. That's really important. I wonder if you'd be open to my offering maybe a suggestion of a way to kind of organize your medicines and so you can get the most out of your medicines. I have something I'd like to offer you if you'd like to take these. These are some pill organizers, and if you'd like, both you and your husband could take them home. As you see, they have little compartments for every day of the week, and there's a morning and an afternoon slot. And what most people do is they pick one time of the week in which they fill them all up, and then you don't have to think about it the rest of the week. You just kind of take them out, and there they are. I really think this could be helpful for you and for your husband in keeping all your medicines organized. I wonder what you think of something like that.
Oh, I think it's a wonderful idea. That is, if we take the time to fill them up.
Yes, that is true. When in your schedule might it work for you to fill them up?
Maybe we could fill them up on Sundays after brunch. That's usually when I cook and get ready for the week ahead.
I think that sounds like a really good plan. Okay, so we've got a plan for how to organize the medicine. Let's talk a bit now about how to remember when to take them. I'll tell you, many patients find it helpful to kind of pair in your brain some habit that you already have with your mind of taking the pills. So, what is something you already do on a daily basis?
Maybe when I brush my teeth, I do that twice a day.
Okay, well, that's a really common one. That's actually a great idea. So, you can kind of remember every time I brush my teeth, I want to take my medicine. So, I really like that. So, now we have this little brochure I'd like to give you. This is, since taking medicines regularly is so hard, we've created this called Getting the Most from Your Medicine. This has some tips in it that you might find helpful, so I'll send this home with you. But on the back here is a place for you to kind of jot down your goal. So what I'm going to give you this pen, if you could kind of write down the two things we talked about. Number one, filling the pill organizers on Sunday, so you have it all organized. And secondly, remembering in your mind, brush teeth, take medicine, to kind of have that cue for yourself. Would you mind jotting that down for me, please?
Absolutely.
Okay, then when you come back in a couple of weeks to follow up on the diabetes medicine, I'm going to ask you, how are the pill organizers going and the toothbrushing, okay?
Sounds good.
All right.
Thank you.
Yes, you bet.